and welcome to Stork'd, the podcast in which we explore the many ways to build and define family. This is your host, Julia, and today I am so excited to introduce you to the woman who's kind of rebranding infertility and trying to change the patient experience. Today I talk to Dr. Aimee. She is widely known on the interwebs as the Egg Whisperer, and she wants us to stop going to battle with our bodies. Sometimes infertility can feel like a battle. We are fighting a biological clock. We are racing against time. We are fighting our own bodies. We are fighting with insurance providers. We are spending a fortune. Sometimes we are working with doctors that don't listen to us. We have to track ovulation and track 2-week waits and track days post extraction and all these things. It's a lot and it's very stressful. And Dr. Aimee wants to reframe that and think about it not as a battle, but more as this joyful creation of love by creating life. And so even the trigger shot, she jokes around as being this wonderful glitter sparkle unicorn shot. And she's also, in addition to trying to rebrand or reframe or reimagine the patient experience around infertility, she is also pushing the envelope, guys, and doing some things that may not be clinically proven, but seem to be working in her patients. This is also a 2-part episode. You know I love when episodes have a little partner and 2 sides of the story. And so first, we're going to hear from Dr. Aimee about her methodology and this transformational patient experience that I just described. And then next week, we're going to hear from one of her patients, Barbie Blank, about her fertility journey and her experience working with Dr. Aimee. I fell in love with Dr. Aimee. I just love her warmth. I love her sincerity. I love her vision for having a huge impact on all those people who want to have children. And I really think this is a special episode. If you like it as much as I do, in addition to signing up immediately for anything that Dr. Aimee offers, I recommend that you share this episode with a friend. You never know who may be battling it out in the infertility battlefield. And don't forget to sign up for the Stork'd newsletter and subscribe to our social media. Here is Dr. Aimee. Hello and welcome, Dr. Aimee. Thank you so much for coming to Stork'd, the podcast. There is a lot for us to talk about today. This is the podcast in which we explore the many ways to build and define family. And I know that you do that all day long. So let's get right to it. Can you tell us a little bit about yourself?
I was going to say, Julia, I think I do it in my sleep as well. Yeah. I mean, I'm totally obsessed with bringing more love into this world. I'm on a love, what's the word I'm trying to use? I'm on a love mission. And I've been on that mission since I was born. And I'm on that mission more than ever before. Call me a maniac love maker, but not in the sexual way. Because as you know, there's no better way to bring love into this world than through the love of a child, and I get to see so many amazing people that come into my life, into my office, and they're just looking for that and they want that love. And, with what's going on in the world, I just feel like we all need a little bit more love, and children are the best way of doing that. So I'm a baby maker. I'm a fertility doctor. I do IVF. I help people in so many different ways to have families. And I always just make sure that my patients' priorities are mine.
I love that. There's a lot going on in the world today around IVF and whether it's appropriate for everyone. I just read an article today even that just was railing against the fertility industry because so many doctors don't think about the patient's personal lives and what is best for them. And they're thinking about the science and how to make those babies. So I'd love for us to talk a little bit about the fertility industry as a whole. But before we do that, I want to highlight that you are a trailblazer, among many other things. There are a lot of men in this industry, and you're one of the few fertility doctors that is female. And did you know from the beginning when you first stepped into medical school that this was the path for you?
Probably when I was 12. I knew when I was 3, I wanted to be an OBGYN. 12, I wanted to help whoever wanted to be a mom, become a mom or a parent. And it's personal, it has to do with my mom's struggles. And my father was an OBGYN, my grandfather. So it was just genetic. I just have this gene that I want to help people, but also just help people have a baby if they want to.
I was going to say 12 is a very precocious age to even know that some people have trouble having babies.
Yeah, I know.
And can you tell us a little bit about your moniker, the Egg Whisperer? What is it that you're whispering to these eggs?
Yeah, I'm whispering, don't give up. and hope never killed anybody. And so sometimes a lot of the things that we do may not have a really good chance of working, but I always tell my patients that sometimes you have to go through the bad stuff to get to the good stuff. And there's value in having experiences that don't work because they inform exactly what you should be doing next. And if you didn't go through the crap, you wouldn't have known what was going to be, what was meant to be. So that's what I'm telling the eggs. And I also think that if you're taught, and I do this and it's so weird, I know, but like when I go into an ultrasound room and I look at my patient's ovaries, especially when there's one egg, I say, wow, this follicle is so beautiful. So I feel like if we're talking really nicely to the eggs, I mean, maybe they're going to do what I want them to do when they get fertilized by sperm.
See, when you say it, that sounds like it comes from a place of love and kindness. There's a doctor in Boston who's gotten this reputation for calling every woman who is his patient that he says, you have a beautiful uterus. And there's something that several of his former patients and I have felt very creepy about that. Like, oh, there's something like you're looking at my insides and you're going, you have a beautiful uterus. But you're putting a little bit different of a perspective on it for me, that you're gently, kindly encouraging the eggs.
What I'd say is there are probably things that I can say a man can't say, like, we're going to F your eggs right now. Right. And that means fertilize. So, I mean, I try and make jokes and make things light and funny, but I do get that there's definitely a gender difference in terms of things a woman fertility doctor can say that a man can't.
No, for sure. Now, when you're talking about like, I just want to go back to that concept that you have to go through this, the icky parts, the difficult parts to get to the good parts. I mean, that's a metaphor for life, right? It's the forest fires end up creating the most beautiful flowers afterwards, et cetera. Are you talking about life events? So for instance, I had to go through dating a whole bunch of terrible people before I could decide to go and be a solo mom and have my kid. Or are you talking about the artistry of trying to figure out what's best for a patient in terms of the chemistry and the medicine that you're giving them?
I mean, it's all of it. I think figuring out what's best for the patient starts at the beginning. I have my process that I go through with patients to get them to the right protocol and the right treatment that they feel comfortable with. And I never rush anybody. And then as far as the life events, I try and teach people the things that I learned to get to where I am today. And I had to learn them early on because the journey to become a doctor is very difficult. And imagine being in school for 15 years only to learn that an egg and sperm make a baby. I mean, that's kind of, it takes a lot of endurance. So being a fertility doctor takes endurance training. Being a fertility patient definitely teaches you endurance. And I feel like those life lessons that I've learned, I try and teach my patients so that they're seeing the bad stuff as maybe not as bad. And then I also try and make the journey, I describe it as an odyssey. Yeah, and I've learned things as I've gotten older and gotten more experience. I mean, I wasn't as woo-woo 15 years ago as I am now. You know, I try and tell my patients, especially, you know, people who are coupled, like, I want you to enjoy each other. Like, I would probably be throwing up in my mouth if I even tried to even say that 15 years ago. But now I can really say it because I believe it. Like, I want people to love each other. I want them to feel like this process of getting to a baby is a very spiritual one where you're learning about your body, you're nurturing your body, you're taking care of your body. It should be a journey that's enjoyable. It shouldn't be terrible. It shouldn't be stressful. Obviously it is, but I feel like if we can frame it that way, like, this is going to be fun. I'm going to learn about myself and I'm going to do things that will nurture my body so that I can bring that baby that I know I want and will have into my life. Like, that should be fun and exciting and enjoyable. It shouldn't be like stressful and inducing of like PTSD and anxiety and all the things that can happen, like depression.
Oh my gosh, but like, how different is that? I've had so many of these conversations, and most patients will tell you that it was a battle. My body wasn't working. Something was broken. I had to fight it. I had to inject it and cause bruises. I mean, the language we use to describe fertility treatments is like going to war against yourself. And you've just said something totally different from that.
Yeah. I mean, we call the freaking shot you take to mature your eggs the trigger shot. I mean, it should be called like the sparkle unicorn glitter shot. You know, it should be something else, don't you think? That's like a terrible name. I mean, the egg maturation shot. I mean, even that's better than trigger.
So if I were a patient of yours and I came to you and I said, I've been battling it out with other fertility doctors and I'm tired and I feel war weary and down, what would you tell me?
Take a break.
But I don't have time, I might say. Like, how can I take a break? I'm already stressed. I'm channeling. This is not my story, but
No, I would say that none of this is an emergency. None of this happened overnight. Taking some time off to really just, first of all, get off the hormones so that you can figure out who you are again without being hopped up on all these drugs, and then really center yourself and figure out what you really want and what it's going to take to get there. And then really be practical and honest about, at this point, if you're someone who's gone through a lot of treatment, be really honest about what your chances are. I see a lot of patients who are trying at 45, 46, 47, 49, 50, 51. And if a man was 45 to 51, we wouldn't think they're crazy. But for whatever reason, when a woman is that age, we're shamed, which is unfortunate. But at the same time, the celebrities don't help us at all with that, because they make us think that it can be done. So my point in saying that is, if you're someone who's done a lot of treatment, you have to be a little bit more realistic with what the likelihood of success will be. And so sometimes taking time off, talking to a therapist, getting another opinion can be helpful.
Tell me a little bit about your client base. Are you the doctor of last resort? Are you seeing a lot of people who have seen other doctors and come to you with desperation? Are you the fertility doctor that most people are going to for preventative care? And what I mean by that is egg freezing with the anticipation of maybe needing them later. Do you see more people with endometriosis? What does your typical patient look like?
Yeah. I mean, it's all of those things. It's the fertility preservation patient, is the fertility curious patient, it's the struggling and trying, it's the recurrent pregnancy loss patient, but it's also you have only 1% chance. Donor egg is your only option. That's my thing. I tell patients, I don't know that I really say this out loud. Maybe this is the first time I'm saying it out loud. I specialize in OLS. That's my own thing. Ovarian Life Support.
Okay. All right.
I'm going to squeeze every last egg out of your ovaries that I possibly can before you go into menopause. I see patients that are 42, 43, 44, and I get healthy eggs sometimes. Not all the time. I mean, I can't say that I'm not a magician, but I do think that there's some things that I'm doing that I think other doctors are hopefully going to do in the future as well. But I feel like some of those things really can be the difference between someone having a pregnancy with their own eggs versus an egg donor at an age where most people need an egg donor.
Wow. Okay. So can you summarize a little bit about what it is that makes you different for a layperson? I know there's some proprietary processes, I'm sure, and some of it's going to be really hard to understand for somebody who's not a doctor. But, what is it that you do other than have the sparkly unicorn mentality that so few people have?
Yeah. I mean, again, it's the process. What's your diagnosis? And don't just say it's age, really think through, could it be endometriosis, adenomyosis, or missing an autoimmune condition? And then there's supplementation that I talk to patients about. I talk about lifestyle. And then there are things that are a little fringe. And I'll say that out loud. A lot of people say that these are experimental, or they don't believe in them, or they don't work. And that's things like ovarian PRP. So that's something that I learned from Dr. Murphy in New York. He actually was so kind to teach me exactly how to do it. And so I do it just like him, because I had a patient who was 48 years old. She'd been menopausal for, 5 or 6 years. And all of a sudden she had 3 follicles. I'm like, where did these come from? She's like, Dr. Murphy did PRP on me. I'm like, who's this Dr. Murphy? So I got him on the phone. I'm like, we need to be friends, because if that happened to her, imagine what I could do for the 36 or 38-year-old who's basically perimenopausal, not being given a chance with her own eggs. And then I started doing it as well. And then there's also other things. I also ask my patients to consider using red light, HGH. So those are and different protocols too that I use that other people do, but not everyone.
Okay. So would you mind breaking some of these terms down for me? What is PRP? What is red light? What is HGH?
Totally. So we'll say PRP is platelet-rich plasma. It's taking the growth factors from the platelet-rich plasma in your blood and then injecting them into the ovaries through a procedure that's just like an egg retrieval. So it's a tiny needle in each ovary while you're asleep. I do it under anesthesia for my patients, and just about 2.5 milliliters in each ovary. And there's a way that I do it around the ovary. And then red light, it's low level light therapy. There's something, again, this sounds so weird to even be saying this, but I've had patients where it's like, that's the only thing I did different for them. And it worked. It's like the next cycle worked. So you're not going to find some randomized double-blind clinical trials, taking two groups, one with light and one without. It's basically a heating pad with red light.
Yeah. Is that like those blankets that you climb into, or is it a medical version?
Yeah, no, it's like a heating pad that you just put on your lower abdomen, and I tell patients to use it about 20 minutes a day, or, maybe twice a week. It doesn't have to be every day. And then HGH is just human-derived growth hormone. It doesn't help everybody, but it's something that I sometimes add to the protocol, or sometimes they take it before they start stimulation meds.
Amazing.
Yeah.
Wow. Well, it does sound like you're doing some really interesting and slightly different things. Tell me about how you work with people who aren't in the same state and city as you, who don't have access to the financial resources to work with you. How might somebody like that think about approaching their fertility when they don't have face-to-face access to Dr. Aimee?
Well, I literally want everyone to have me as their doctor if they want me as their doctor. And that's why I put out so much on my website, on my podcast. I literally share exactly what to do from A to Z. And then what I found is my classes. So I have classes through Teachable. So if you go to eggwhispererschool.com, it's based like signing up for one of my IVF classes. Even if you've gone through IVF, it's basically like a master class for people who've even done IVF. It's kind of like getting a full consult. I go through all the steps. So for me, the recipe for IVF success, and I have that in quotes because not every IVF cycle is going to be successful, but success for me means doing our very best to give ourselves the best chance. So I go through the 4 steps to get through IVF success, my recipe for success, which is the Egg Whisper diet: diagnosis, IVF, embryo transfer prep, and transfer. It seems so easy and simple.
It seems straightforward. Yeah.
It's very straightforward. So I go through all of those things in my class. And then I also have an app. It's the Egg Whisper app. It is not live yet, but it will be live very soon. And I have a license to practice in every state in the country. Yes, that was not easy to get.
Is it like a law school exam where you have to take 50 exams, or did you?
Yeah, a lot of them are exams.
We talk to a lot of people on this podcast who wear many hats and who push themselves in many directions. And you're doing that, right? You're seeing patients, you're creating courses, you're creating podcasts, you're creating educational resources, you're creating an app. What fuels you to keep doing so much work? You are literally taking exams in every state in order to be certified so that you can give advice to more people. That is a tremendous amount of work. What's fueling that? What's behind that?
CNN. You go to CNN.com and it's like the world is ending.
Yeah.
Literally. Every day I'm like, girl, you get that Wonder Woman suit on and you go to work. You got to help these people have babies. And so it's just really hard. If you just look at what's happening, just like in the last few days, it's just heart-wrenching. And so I got to make up for the evil. So that's kind of my way of making up for evil. And I'm a hyper empath, if you can't tell. Just even talking about this makes me cry. And so my heart breaks for each and every person who can't have a baby when they want one. And so that's what I'm doing and why. And I won't stop. I can't. The minute I say I don't want to go to work today, that's the day I'm dead.
So for those people who are not watching this, Dr. Aimee, you're tearing up.
But it's the damn truth,
I know.
I'm 47 years old. I've been doing this practice for 15 years. Every single day, I have not once not gone to work. Not one day have I not worked, especially in COVID. That was a really tough time. And I just not looking back, I just keep going because there's so many people that need me and they need to hear my voice of hope and positivity and to tell people it's worth it. Like, it's going to be hard to have a baby now more than ever. Look at like resources in the hospitals, the access to OBGYN. It is hard, but I still want people to believe in love because people are choosing love around me. Like, people who are coming to my office, that's what they're here for. They're here for love.
And I'll tell you, for some reason, the news is hitting me in a deeper way. I was always very affected by the news, but since having my munchkin, it gets to me and it gets under my skin. And part of it is that the world has gotten progressively worse every day since COVID, or even earlier than that, since certain elections. But the one thing that's keeping me going when I hear horrific news is I would like look at his face and he smiles. And it's like, okay, there is still beauty in the world. There is still something very, very special. And now, not everyone wants kids. And so if you're hearing this and you say, well, that's not for me, totally get it. But for me, my purpose is his smile. And so when you say more love because I have to combat the evil, like that resonates so deeply.
And I have 4 kids and I want this world to be a better place for them. I'm going to try and live till I'm 150. I'm going to try my hardest to do that. But I know I'm going to leave this world at some point, and I need to leave it with amazing humans that have amazing children for them.
Wow, that's really incredible. I did not know that this is where the conversation was going to go, but I'm like finding myself so deeply touched by it. One of the things I struggle with quite a bit when I talk about fertility in general, and there's actually quite a few. I mean, it seems like a straightforward topic. It seems like, oh, everyone should have babies, but the process to get them is really tricky. So I struggle with 3 things. I struggle with, to me, fertility treatments seem like they're more art than science. And there's more luck, there's more spirit, there's more magic, and there's more times when it just doesn't work. It's not lucky, it's not effective for no reason than you would think based on all the research and the papers that might be. How do you counsel somebody who's going through the process of saying, okay, I've got to stop. This is not the way I'm going to have my kiddo. Does that happen often, or do you just keep going until you get a baby?
Well, I mean, what I say is that not everyone was made with a uterus that can carry a baby. Not everyone was made with ovaries that will have healthy eggs. And that's just not your fault. I mean, that is biology and you can't control it. But what you can control are the decisions that you make. And, I've learned these lessons through all the experts that I've worked with over the years. And I had one amazing psychologist. She used this line with me and she said, you just have to think of it as a choice to pass on your own DNA or to have a baby. Which one's more important to you? Mm-hmm. And a lot of people are like, I just want a baby. Like once you get to that point, the DNA part isn't as important. And then you just focus on, having the baby the way that you need to because of your biology. That again is not in your control. But this is such a personal thing. We shame ourselves over, I had a patient, let's just say she's 36 years old, early menopause. And I always start my conversations with, why do you think this is happening to you? Because I think a lot of times people aren't listening to the things their patients are saying to them, and the patients know the diagnosis. I mean, she said something that wasn't the diagnosis, but it proves the point of us shaming ourselves. She said, it's because I partied too much when I was 20. Like, no, I'm going to take that away from you. Give that to me now. I said, and never say that again, because it wasn't your fault from when you were 20, But my point is that I have really difficult conversations a lot of the time, because if you think about the number of IVF cycles that are successful in this country, it's still under 50%. Mm-hmm. So under 50% of the time for people in general, everywhere, the likelihood of them being successful, all ages, is going to be under 50%. So more than 50% are going to be very disappointed.
So is that per couple or per cycle?
Probably per cycle.
Okay.
Per cycle. And then if you look at the number of miscarriages that happen in the country, I think it's been like 5 million miscarriages a year. I mean, it's in the millions. That's a lot of heartbreak every minute of every day.
Isn't it 1 in 5 pregnancies?
At least.
Like that? Yeah, at least. My statistics are a little off, but yeah, that's a significant amount of miscarriage. We don't talk about that enough. We don't support people through it enough. Say, okay, keep trying, keep pushing through.
Right.
That's an interesting one, because on one hand, you are bringing this sparkly unicorn energy. Let's keep fighting. I will wear my hero suit. I will suit up, I'll armor up, and I will just work with you to make this happen. And we have to give space for the grief and the loss and the support. How do you balance when somebody's going through a loss, holding hope for them or helping them hold hope and push forward, and also giving them the space to work through the pain of having a loss?
Absolutely. It's just being there for them and letting them know that I'm thinking about them and I'm following up with them, talking to them, offering them psychological services and support, bringing them back in, not telling them they need to now wait 6 months until they try again. I mean, there's all sorts of things I hear like, oh, you need to wait a year. You need to be on birth control pills for 6 months. I'm like, what? Like, you don't need any of those things. You just need a plan. You need to come up with a plan that works for you. For some people, it's taking a break indefinitely. For other people, it's, I want to take a cycle off. Most of my patients, they would like a plan right away, and they're ready to talk about it within a week, let's say, of a loss. So everyone's different, but I can tell what a person needs based on the conversations that I have with them so that they're not feeling abandoned. They're not feeling like no one cares about them.
I mentioned that there's three things that really concern me about the fertility world, as much as I am a champion for it. The first is navigating when it's not going to work or navigating loss. Second is affordability. And we talked about that, making it a little more accessible through apps and educational resources on your website. What do you think the fertility world can do to make it more accessible and financially feasible for more people?
We need more fertility doctors. We need more clinics. We need more trained embryologists. I mean, that's the hard part, is there's just not enough of us anymore. There used to be, but there just isn't now. As people are waiting longer to have a baby, more people need our help. More people are having secondary infertility because they're waiting longer to have their first babies. They need us for their second baby. So that's what's going to make it more affordable. If there are more embryologists and more fertility doctors and more clinics, then we don't have to work people so hard. People can have a better work-life balance. I don't believe in work. For me, it's all fun.
I was going to say, not work people so hard, the person who hasn't taken a vacation.
I don't think of it as work. So like, it doesn't apply to me. But I feel like if there's more clinics, if there are more people that can help patients, then I think that would potentially help with cost. And there's also new technologies, and there are clinics. So I do refer patients to other clinics for treatment because I know it's cheaper outside in the Bay Area. And I know who those clinics are that will take really good care of my patients. And they've been doing a great job.
That's incredible. And thank you for that. Thank you for fighting for more access for more people. It's really important. If you imagine 10, 15 years from now, you're still working, hopefully you've taken a vacation, not because you see it as work, but because I think you deserve it on behalf of every baby you've ever created. But 15 years from now, what do you hope is different in the fertility industry?
That we have a pill that will reverse ovarian aging. I would love to see that be a reality. So that might be. I mean, there's a clinical trial right now at Columbia University looking at rapamycin as a way to reverse ovarian aging. It seems promising from animal studies. Like, that would be amazing. I would love for a woman not to have to do an egg retrieval by putting a needle in her ovaries, maybe finding another way to retrieve eggs. I would love for us to, as a society, cover fertility treatments for everybody, make egg freezing free for doctors, especially. I feel like, as physicians, we put off so much of our lives, and our milestones tend to be a little bit later than others in terms of when we get married, if that's something that we want to do, have babies. So have medical schools, just like Google offers free egg freezing, offer egg freezing to doctors and sperm freezing as well. I mean, I can go on and on with my wish list, but those are a lot of the things that I wish. I mean, I wish that anytime a woman finds out she's pregnant, like, we send her like gift boxes of healthy food and supplements and vitamins. From the very beginning, she says, I'm pregnant. This is how I think the world's going to be a better place. If we nurture our future from the start, from the beginning, from the embryo stage. And if we can support women in the workplace, giving them the time off they need in the first trimester, third trimester leave, fine. Maternity leave, okay. But most women spend their entire first trimester hiding their pregnancy from their employer when they're the most stressed, and the time that they're nauseous and they're not eating well, they're not nourishing the most precious thing in the world, which is their unborn baby.
That's quite the list. It's really important that we think about the future. I love asking that question. I don't ask it in every episode, but I love that question because we're all working towards a better future, and you're working your ass off, pardon me, for more babies and for a preferred future for everyone to have access. And so sometimes it's nice to understand what that vision might look like. But do you think any one of your 4 kids is going to follow your footsteps and be the 4th generation OBGYN?
Absolutely. I mean, my son, he's 11, and they did their like human reproduction class. And he said, Mommy, I don't need to go to class. I already know everything. And so he's just such a kind soul. He's going to be just like you. I'm going to help people just like you. And I think I've probably helped like 10 people in his class. And it's the cutest thing because their parents, you know, they've shared openly with their children that, you know, they say things that are funny. They're cute. Of course, it's not like Dr. Aimee made you. I'm like, no, I might have been in the room, but I didn't really make you. So I think at least one of them will be a future fertility doctor, I think.
Oh, it's incredible. Is there anything else about the work that you do or the state of fertility treatments in the US that you want to talk about today?
Yeah. I mean, what I want to tell people is that you have to own your own data, your own records, and really know your story. You can't expect someone that's never met you before or someone who's maybe meeting you 10 minutes at a time to know everything about you. So you have to be an empowered patient these days. And the culture has changed where, you know, 6-7 years ago, doctors would be upset if you Googled something. You know, they say,
Yeah.
why Google it? Now the culture has shifted. It's like, why are you asking me when you have Google and now you have Chat GPT? Like, why are you even wasting my time? So, you know, things have changed. It just means that you have to not be ashamed to ask the questions. Don't apologize for those questions. And then also present your data. Every time you meet a new doctor in a fertility clinic, because a lot of these centers have like, 7 doctors that are rotating and not everyone's going to know you. So it's important for you to know yourself and not have the expectation that they should know everything about you, you know?
Mm-hmm.
So I feel like if you're doing your third retrieval and you're feeling like no one's paying attention to the details, you should know the details so that on the day of your trigger shot, you can say, I just want to remind you, last time, this was the size of my follicles. These are my hormone levels. You triggered me at this time. And this is what we discussed for the next time that we would do. Because it could be a completely different doctor making that trigger shot decision plan. So you don't want mistakes to happen. And the best way to prevent mistakes is for you to be a part of all the decision making that goes on during your cycle.
Yeah. I mean, there can be a lot of mistakes that happen. I mean, there's so many nuanced, complicated, detailed elements of this process. And we're all only human.
Mm-hmm.
Yeah. That's really good advice. Okay. So what I'm hearing is if you want to walk away with some takeaways, be an empowered patient, really own your data, go check out the incredible resources that you've created. Don't necessarily give up hope. You're not battling with yourself, right? It's should be a little bit more joyful. I mean, these are some huge topics that we've covered in a very short period of time.
And get my lube. I have a great lube, the Egg Whisperer lube on my website.
Okay.
And my pants, they're crotchless.
That's so funny. And you know what? Because my fertility journey didn't involve that, I was like, why does she sell that? And it took me a second to figure that out when I was on your website. It's like, what is this thing? Yeah, other people use intercourse.
Yeah. Well, even the lube for other things too.
Yeah. Yeah.
Safe.
That's wonderful. Before I let you go, you have 4 beautiful children and you have helped create countless others. You said 10 in your kids' class alone, maybe, by way of using a numeric example. What does family mean to you? What does it mean to create families?
I would say the best name anyone could call me is mommy. They just clobber me when I get home, The 15-year-old thinks he's just too cool. But the 6, 10, and 11 still think I'm pretty cool. So no, I mean, I think for me, I know how amazing it is to be a mom.
Mm.
And I want as many people to feel that same joy that I feel. Yeah. So that's really what it is for me is I'm just so incredibly lucky and blessed. So lucky. I know how lucky I am every single day. And I want and believe that other people deserve the same that I have. And I want to do everything I can to help other people have the same.
That is really special. Thank you.
Yeah.
We want to find you. How do we find all of this incredible stuff that you pulled together, including the lube?
Well, my website's probably the easiest place to go, draimee.org, draimee.org. You'll find my podcasts. You'll find my blog articles. You'll find the classes and supplement lists. All of will be there on my website.
That's awesome. Thank you for doing all that. And thank you for joining us on the podcast.
Thank you for listening to Stork'd with your host, Julia Carroll. This podcast is changing the conversation around the ways people define and create family. If you like what you hear, please support us by sharing with friends and following on Instagram at Stork'd_podcast. We also always appreciate it when you rate and review us wherever you listen to your favorite podcasts. For more information, visit storkedpodcast.com to sign up for our newsletter. That's STORKD podcast.com.